Hi, and welcome to Couch Conversations Beyond the Textbook, where real talk meets real life in the world of mental health. We're your hosts, Abby and Bethany, two therapists who have been through the textbooks and are entering the trenches. This is a space where we unpack what they didn't teach you in grad school, the messy, the meaningful, and the moments that shape us as professionals and people. So grab a seat on the couch and let's dive in. Please note that the content of this podcast is for informational and educational purposes only. It is not intended to be a substitute for professional mental health advice, diagnosis, or treatment. Always seek the guidance of a qualified mental health provider with any questions you may have regarding your mental health or medical condition. The views and opinions expressed by hosts and guests are their own and do not necessarily reflect those of any organizations or professionals they may be affiliated with. If you are in crisis, or if you think you may have a mental health emergency, please call 911 or contact a local mental health crisis line or emergency service in your area. Hi, everyone, and welcome back to Couch Conversations Beyond the Textbook. I am your host, Bethany.
And I am Abby.
And today we are going to talk about working with kids versus working with adults. Abby works with basically all children, and I work with mostly all adults. So we have a little bit different ways that we go about our days.
Yes, true.
So Abby, start us off. Tell us about working with kids.
So working with kids is, first of all, I thought I hadn't worked with kids before we got into our private practice. I had worked with college students. So, I mean, they were right in between, like entering adulthood and leaving mom and dad's house.
Mm-hmm.
But I thought mistakenly that when I would start working with kids, it would be easy to gain their trust. They're kids, it'd be easy.
Mm-hmm.
And to my surprise, it has been much harder to gain that relationship with children than it was with adults.
Yes. Yeah. I worked with kids over the summer, and I remember thinking that same thing. I'm like, this is hard. And you feel like, I remember feeling like this process goes so slow compared to working with adults.
Yeah.
I just remember being like, oh my word, this is going very slow. I feel like we should be making more progress than what we are.
Yeah. And it's been my experience so far that with my my junior high to high school age kids, we make progress a lot quicker than my elementary age kids. And it's been my experience with the elementary age kids that if you have a breakthrough session, you'll usually hit that in the first 2 months-ish, but then you won't get another one for a while. It'll take a while.
Yes.
And
yeah.
it can be discouraging, but when you do get those breakthroughs, they're really big breakthroughs.
Yeah. Yeah. And I think that working with kids, I just remember just from the intake, like you had said, it's a lot of building trust, and it just takes so much longer to build trust. I've had so many of my clients be like, well, what can you tell? What do you have to tell my parents? Or things like that. And you're just like, you're in a rock and a hard place, because technically the parents do have rights to that information, but also it would be so disruptive to the parents if you went back and told the parents everything that was happened in session. So how do you handle that?
Yeah.
Confidentiality with parents and children?
Well, I usually, at the beginning of every intake, the parents are almost always in session with me. I've only had a couple, and it's been my high school age where the parents did not come to session, the intake session.
Yeah.
And I just, I address the kids during the intake. Parents usually are the ones who are giving me a lot more information than the kids are. But I tell the parents, I will meet with you about every 4 or 5 weeks. And unless there's something very serious that involves their safety, it's very important to the relationship between me and your child that I have the ability to keep things confidential. And that you can also trust that I will tell you anything that I feel is you need to know. So it's kind of on a need to know basis. And I know that that's scary. And so I address that with them and say, I know that that's hard to hear. And it's a little scary to know that I'm going to know things you're not going to know.
Yeah, for sure.
But yeah, I just try to be as honest and forthcoming as I can be. And after doing this for the last, 5 months or so, I've also started telling parents because I've noticed that they want results faster than possible. So I started telling parents,
Mhm.
the first month is going to be a lot of gameplay and a lot of getting to know each other and trusting each other. Um, Results are not going to happen as quickly as they would for an adult.
Mhm. Yeah. You said a couple things about how you handle the intake with parents that I thought was really good. Like, you tell them in advance you're gonna be meeting with them every 4 weeks to, you know, kind of let them know how things are going, what you're
Mhm.
seeing, but you don't want to tell them, everything because, even a child should have a right to confidentiality with their therapist. And I think and obviously that's so important to the process too of just gaining trust and really being able to get anywhere with your under 18-year-old
Yeah.
clients.
Yeah. So you tell me, how is that different than what you do?
What I do, it's interesting because I have had a little bit of experience working with kids and now I primarily work with adults. I have some high schoolers, but other than that, I mostly work with adults. And so one of the things that's very different is I think that a lot of times when adults are signing up for counseling, they know what they're coming for. They know why they're coming. They're not being told, for the most part, they're not being told like, "Oh, you need to go."
Mhm.
Or they might be being told, but they know why. Um, and so they're a little bit more motivated, I would say, in knowing what they want to work on. And I think they're a little more in tune with the process, I guess. Like, I think with kids, they don't really understand the process. They just know that they're
Yeah.
there for the most
Yeah.
part. And some I would say teens especially are more self-aware and that they know like they asked to go to counseling, and that might be a little different case by case, but definitely working with adults I find is a simpler process and even honoring that confidentiality, you don't have to figure out what the line is, like, what the lines
Mhm.
are. And with kids, it gets tricky. Like I said, I had clients that would be like, "Well, what do you have to tell my parents?" And that just puts you as a counselor in a really difficult spot, knowing that, the parents do have access to these things
Yeah.
if they wanted to know. I have found that having that conversation up front, and this is one thing, like even during my internship when I started working with kids, I had no idea how to handle that conversation with clients, with their parents. So it was a really big learning curve and learning opportunity for me, and I was so nervous to, like, have the intake with these parents, and, I'm a lot younger than a lot of these parents that I'm seeing, so then I'm like, "Are they even gonna take me seriously?" And, at the time, I didn't even have kids and, so there was already that uh, it going on in my head. But I have found that even just having that conversation with parents, like, listen, this process only works if your child trusts me, and they're not going to trust me if I have to report back every single thing that we say in session. So a lot of times I would say, like, I really want to respect their confidentiality and I can tell you what skills we're working on and where I see growth and where I see like things that they can work on at home, things like that. But I don't want to have to tell you, everything that they say, their deepest darkest secrets.
Right.
Like that's really really going to be damaging to do that. And then there won't be any growth. And I have found that I never had a problem with parents. I know some counselors do. I haven't worked with kids enough to run into a ton of
Mhm.
problems with parents,
Yeah.
but I found that most parents respect that and understand that.
Yeah. In fact, I haven't had any parents who have not. In fact, and a lot of them come in and say, "I'm not gonna be hounding you for information," or whatever it may be, but they are very respectful of that. You said a couple things that I thought were really important to touch on, which one of them was being younger than a lot of the parents, which
Mhm.
I have the added benefit of being generally the same age as a lot of these parents that are coming in and having a lot of the similar experiences. Uh, but I can imagine that it's intimidating to be the person who not only are you younger, you're the person that they are trusting their kids with their most precious things that they ever, and not having the same experience, like, not being able to say, "I
Yeah,
get what you're going through. I know that this is hard." That's gotta be intimidating.
for sure. Yeah, and I mean, to my face, none of them,
Mhm.
actively said anything or whatever, but I'm sure that even it's like doing marriage counseling. I
Yeah.
was just freshly I mean, I'm only been married for 4 years this year, and so it's like, "Oh my word, I'm working with these couples who've been married 20
Yeah.
years, and, like, are they actually gonna respect what I have to say?"
I mean, that's valid, right? We go to the doctor and we get a young resident, and medically, do we
Yeah,
always trust their judgment? Probably not.
right.
And I don't know that
Yeah,
it's much different when it comes to things like this, is when you're seen as a baby yourself to the people that you're trying to help. It's got to be hard.
for sure. Yeah, but I think that there's with kids don't really care
Yeah, the
about
kids don't
that, you
care
know?
for sure. Something else that has kind of come to mind lately is when I'm in session, I do a lot of playing. Like we play a lot of Uno, and I have a basketball hoop on the back of my door and we play a lot of basketball. And I am sure that some of my clients go home and say, "Oh, all we did was play today," or "All we did was color today."
Yeah,
And although that may be physically what we're doing, the parents are not in the room. They're not seeing that, like, I am purposely watching to see how your child does when they're frustrated during a game or when they're
mhm,
losing, how they win, what are they doing to calm themselves down when they get mad. Or I am creating opportunities in games to be able to practice some of our coping skills. And then I've also learned that, like, you can make anything therapeutic, right? We can play
yeah,
a trick shot game, and if you make it, then you have to show me a coping skill that you've used this week. Or, there's
yeah,
something that we can turn anything into coping. So, yeah. So, to any parents or any of our listeners who are like, what does that look like? Is it really just playing? I mean, kind of. We play a lot, but it's
mhm,
also a lot of like, okay, we're going to turn this. How do we turn this into a therapeutic session while doing something that's gonna keep them engaged?
yeah. I love that. I think that's a great explanation. I think play we know is so important. Using our imagination, it's important as
Mhm.
adults. It's so important as kids. And so to be able to as the therapist, we're looking out for things that the child would never know we're looking
Right.
for. And so to them, it is they're just playing games and that's safe for them. But for us, like you said, we're trying to use their coping skills or looking how they react if they are, struggling with losing the games. Like we don't always let them win. Sometimes I've schooled my kids in
Mhm.
Uno. Like
Yeah.
we don't let them win. Like we want to see how they're doing when adversity comes, and
Yes.
working with them through that.
Rage baiting can be
Yeah.
a great therapeutic tool.
Yes. Oh my gosh. Yes. And with parents too, like so maybe they're hearing from their child, all we did was play games, but that's so important for them to know and even like that's exactly how you could explain it if one of them asked you is we're learning skills, they just don't know it.
Yes, that's 100%, and I've always said that my most successful my most successful days are when the child is actively utilizing their coping skills and doing therapy and not realizing they're doing it. Those are the
Yes.
best days, and that's what I
Those are the best
yeah, and
days.
that's what I want it to look like for them.
Yeah, for sure. So with kids, do you find that have you had any kids that are, like, more self-aware that are like, "Oh, I know what you're doing," kinda thing?
Some of my middle schoolers, yeah.
Yeah.
Yeah, and that I usually just laugh and say, "Okay, well, then since let's just talk about why we're doing this." Um, and using terms like rage baiting, I had a middle school client ask me why I was rage baiting her the other day.
It's so
And
funny. Yes, the terminology is
yes, it
intense.
is intense, but I got kids that age, so I knew what she was saying, and I was able to say, 1, I know what that means, and 2, I'm doing it because we're gonna practice, how do you handle it when somebody is purposely making
Right.
you upset for for their own entertainment.
Yes. Because in life,
That's
sometimes people do
yeah,
that.
100%.
Or people just make you upset in general, maybe not for entertainment, but
Right.
people will make you upset, and how do you handle
Right.
that? Yeah, all of those things apply.
Yes. And being able to giggle with about it with them is it's always fun to shock your clients that you know the terminology that they're using.
Yes.
That's usually my favorite.
I don't understand the terminology at all.
Well, just spend a couple days with my kids, you'll learn it.
I know. Maybe I need to. Maybe I need to.
Yeah. But those are some big things with kids. What are some things that you're doing in session that the clients may not realize what they're doing or what you're utilizing is therapeutic?
Mhm. I find my sessions, the way that I do things, I'm just very conversational. I don't do it like, I'm not
Yeah.
CBT, so I don't do a ton of like interventions in that way. I do some interventions, and I would say Adlerian, all of his interventions are more
Mhm.
conversational in nature. And so a lot of the times I'm like sneaking interventions in there that they might not even know, like skills and things that just come out more naturally, I find. And I honestly rely on a lot of the base counseling skills, like reflection of feeling, reflection of meaning, like those things are really important. And also just trying to get to the bottom of like, where is this thought coming from? That's where a lot of my, work ends up being
Mhm.
like, where is this coming from? When do you remember first thinking that about yourself or whatever it might be? So a lot of just questions about the client. And with adults, you can do that because, they can think back like, "Oh, this was my earliest
Mhm.
memory of feeling that way," or
Yeah.
this, whatever it might be, or yeah, that makes sense. Like I can do that. And that's what, I find myself doing. I really don't do that many interventions. I did have the thought the other day though of someone told me that they did sandbox with one of or sand tray with one of their clients who's an adult. I was like, I'd never thought about I mean, I had thought about it, but I just hasn't like I haven't done it naturally of like playing games with an adult client
Mhm.
or doing sand tray with an adult client. And I think that those things can still be so beneficial. So that's something that I do want to definitely push myself. And it might depend on the client. Some adult clients, you're going to be like, no, we don't need to just like sit here and, you know, play a game. That's not going to be beneficial to our conversation. But some I'm like that actually probably could be helpful for them to use and utilize in session, but I hadn't done that before. So I was like that's something that I would like to push myself to do if applicable with the client.
Yeah, I was actually thinking while you were talking about, like, when you have a resistant client or a client who is struggling, you're struggling to get them to open up. I was going to ask, kind of what does that look like when you're in session? And I wonder if playing a game would be something to help distract themselves about the intensity of what they're doing and help
Yeah.
them to kind of relax. But what are some other things that you do
Yeah,
in
I
that?
definitely think that could be helpful. Some other things that I do for what?
When you have a client who is more resistant or just struggling to like relax enough to open up with you.
With a client who is more resistant, especially an adult client, I tend to just realize that they're probably not ready to, talk about the hard things that they came in to talk about. And so I do a lot of small talk and just try to relate to them. And this is where I think self disclosure as a therapist can be really helpful of just being able to relate to them. Like a lot of times I'll be like, what are some things that you enjoy doing? Or tell me about your friends in your life. Or what are some shows that you're watching or books that you're reading? And those are all things that a lot of human beings do. So things that I can relate to them or being like, oh my word, I'll have to check that show out. Or, that sounds like a really interesting book. So just trying to disarm them a little bit and make them feel more comfortable, like make them feel like you are a human.
Yeah.
Because I think that in grad school, a lot of the times you're kind of told to be like the buttoned up version. And a lot of clients, like I even had one write on one of the intake, like, the paperwork before they come in that was like, I really need a therapist who is like real and I can relate to that doesn't, um, that, like, will still tell me, like, a little bit about themselves, obviously within boundaries,
Mhm.
but, like, doesn't that makes me feel like I'm not just coming in, like, talking to a wall,
Right. Yeah.
basically, and I think that that's really helpful. I tend to not to, like, speak highly of myself, but I feel like I have a personality that works well with people that might be a little bit more closed off. I'm just more bubbly, so I can tend to, like, really kinda get people out of their shell,
Yes.
and so trying to just use my own skills that I have
Right.
and that things like that, and use my personality, let my personality come out a little bit in counseling too. So, yeah, that's kind of with adults what I do if I feel like they're holding back or struggling to get dig into the process. But I definitely don't feel like I run into that as much as with
Yeah.
kiddos.
Yeah, and something like what you said about, grad school is very rigid on self-disclosure, and for good reason. They're trying to teach us, um, the extreme, really. But it does kind of cause you to go into, a practice with almost a fear of self-disclosure and what that looks
Mhm.
like. And from, us doing this and just talking to people, I think it's a pretty common consensus that clients want to feel connected to their therapist, and they're going to trust you if they feel connected to you. And the way to do that is to let them
Mhm.
know that about your life. And we're not like saying, hey, give them your address and tell them all of your deep, dark secrets, but letting them know some of your favorite things is not going to hurt anything, and it's going to help them know. And
Mhm.
if you're irritated, let them know, like, I'm irritated today over I got a crappy email or something. Like, you don't have to give them the story, but you can let them see some emotion, and that's okay.
Mm. Mhm. And I think that can even be important of
Yeah.
like, I'm really frustrated today, but this is how I'm handling it.
Yes.
And that can be really impactful too. Like we can teach by doing
Yes.
how we handle things. And like you said, that doesn't mean that they need to know the whole
Mhm.
situation, but anyone can relate to your feelings. Like that's how we relate to each other
Yes.
as people is through our emotions and things like that. And I think that can be super
I
helpful
agree with that.
in counseling too,
Yeah.
even with kids too.
Oh, yeah, for sure. I mean, some of my older kids, they wanna know about my family, and Um,
Mhm.
I'm pretty open, especially when I have boys around my son's age. They love knowing that I have a kid at home who loves to play basketball as much as they do.
Yeah.
When we have these trick shot tournaments in my room, often they'll say, "Are you gonna tell your son that I made that shot?" And I'll be like, "Yes, I am.
I
That was
love that.
super awesome," and things like that.
That's amazing.
Yeah, so, it's just to let them know. I mean, I also have a picture of my family on my computer, and that's also, hit or miss. Some people are okay with it, some people aren't. I work with kids, I'm not real worried about it. If I was working with adults, it'd probably look different.
Mhm.
But, yeah, so, yeah, I think self-disclosure, like we are taught, it should be therapeutic, but what looks therapeutic to one client might look different to another.
For sure. Yeah, and I think you just start to get the feel
Mhm.
of, like, when it could be beneficial and when it was probably like, there have been times where I've self-disclosed that I'm like, "Why did I say that?" And I think we've talked about this before, like, asking yourself, "Why did you say that?" What questioning yourself of, like, "Did are you saying this because it's gonna make you feel better or because it's actually to benefit the client?" But there have been times where I'm like, that probably wasn't it obviously wasn't destructive to the therapeutic relationship, but I'm like, "That probably wasn't necessary
Mhm.
for me to, say at that time." But there've also been times where I'm like, "I actually think that really helped the client open up a little bit more," or whatever it might be. But yeah, it's interesting. Yeah, just with kids and adults. I find that actually kids ask more about my life than adults do. Usually adults, I feel like for the most part, kind of respect a lot of my clients mostly respect, they're not asking me all the details of my life.
They tend to understand that boundary a little bit better.
Yeah. Yeah. And like you said, it is different with kids than with adults for
Mhm.
sure.
Yeah, gotta love those curious little minds.
I know. I do miss sometimes working with kids because it is just a different you run sessions so differently than with adults, and
Structured
sometimes that's a
chaos.
nice way to break up the day.
Structured chaos is what I call it.
So tell me about learning to write a progress note when you're working with kids, because it looks
It
different
does look
than
different.
when you're working with adults.
A lot of a lot of times it'll say, you know, the client was extra distractible today, or, we
Yes.
worked on this, this, and this, and I got this, this, and this out of it.
Mhm.
because it does look way different, and what I could have from one client to the next as far as distractibility and focus and what I am working on with the kid could be very different than what the kid is working on for themselves that day, which, I mean, it could look like we're working on stop, think, go, which is like you're going to stop, think about your reaction and the consequences of your reaction, and then you're going to go ahead and choose a different reaction. And that's something that I work on a lot with a lot of my kids with emotional regulation. And we could be working on that, and the kid could be up in the corner playing in my Lego box and trying to get their attention back to the session. And that can be really hard. And there are some days where it's a wash and it's not happening.
Mhm.
And I let my notes reflect that, and I just say, the what the intention of the session this week was this. They were very distracted and we didn't get to it. And that's okay. Like it's and those sessions, a lot of times I will reach out to the parents and say, "Hey, we this is what we were working on today. Your child was, slightly distracted and unfocused, so we'll try again next week." Something like that. Because sometimes it could be a matter of parents forgot to give them their meds before session, or they need to
Yeah.
know, your child is extra unregulated at this time, so maybe we should change things around. So,
Mhm.
yeah.
Yeah. I'm curious how there's a lot of times where I feel like a lot of the kids' behavior can be attributed to some things that are happening inside the house or parenting styles. So, how do you navigate that as you're working with kids when you're like, actually, a lot of this is coming down to what the parents are doing, but the parents might not recognize that?
We do a lot of circle of control activities, which is a lot of, I can't, because the parents are not my client, right? So I can't go and say, "Hey, you're this behavior that you have is affecting this behavior." And, it's more, and it's harder with the youngers, but I would say from third to fourth grade on, there's a version of circle of control that they can understand. And it's not so
Mhm.
much like we can't be disrespectful to our parents and we cannot go against what they're telling us to do. But in the moment that whatever their behavior is that is causing you to get heightened and distressed, what is it in that moment that you can do to regulate yourself so you can come back to it and achieve what needs to be achieved on your end? And
Mhm.
so we do a lot of that. There have been a few times where I've gone to my supervisor and said, "I don't know what to do here," you know, and it will go with what the supervisor says. Sometimes it's well, you might want to send an email, and sometimes it's have them come into session and you need to have a hard conversation. But I always just go to my supervisor and I'm like, is this something that I need to address with the parents or not?
Mhm. Yeah. That's the beauty of
Yes, it
supervision.
is.
I do find that it's difficult when you're seeing a child and you're teaching them these skills and you're letting the parents know this is what we're learning. This is what you can be practicing at home, knowing that they're not going to practice it at home. So then progress is even
Yeah,
slower, and that can be discouraging sometimes as a therapist.
absolutely. And when it's behaviors that the parents want to change in the child, but you see that the parent is doing the same thing, that
Yeah.
can be really hard too, because where does change start? But all I can do is do my best to work with the client or with my client, not with what the parents are doing.
For sure. Yeah, all you can do is, yeah, like you said, working with the client and teaching them what you can and what you know, and hopefully they take some of it. And yeah, it is, I will say, seeing growth with your children clients is really cool because you really put a lot of work into it.
It is cool. It's definitely a different kind of tired working with kids at the end of the day,
Mhm.
but it's a sense of like we are nipping this in the bud really early, and we're giving this child a chance to grow beyond what their environment is allowing for them. And I
Mhm.
think that that's really
Yeah.
cool.
Yeah. That is
Yeah.
cool. It's cool to see client growth in general, but definitely with kiddos,
Yeah.
it's really fun. Makes the job worth
Oh,
it.
100%. 100%. So our program did not allow us to work with kids under the age of 16. I think it was 16,
Mhm.
and with kids who were under the age from 16 to 18, it was very limited how much time
Mhm.
we were allowed to do. I'm interested to know what you felt when you found out you're gonna be working with kids. Right out.
I never so I had always kind of thought I don't really want to work with kids, but in grad school you're just grinding
Yeah,
for hours. So when my supervisor was like, I have a couple kids that are, wanting that need to see an intern because, they can't afford
yeah,
the licensed therapist rate, which as an intern, that's most of the clients that you're going to get are ones that either don't have
mhm,
insurance or their insurance, deduct or whatever payment is a lot higher.
yeah.
Anyway, so I had a couple kids and I was so nervous, but I obviously in our program, I knew that the hours would be limited, which also I think is a little silly because I know that there's some people out there that really want to work with kids and there's a big need for child counselors. So that's my little
Soapbox?
caveat to that.
Yes.
But yeah. But anyway, so I was super nervous, but it was a great experience. I had gone in thinking I don't want to work with kids at all. And I I really did enjoy it. I don't think I could do what you do and work with kids full time. But honestly, having like one or two in there in your caseload to break up the day, it was really nice during internship. And I learned a lot from them. I think I probably learned more from them than what they learned from me at that time, but it was good. It ended up being a really good learning experience and I'm happy at the end of the day that I have that
Yeah.
experience too.
Yeah, I went into grad school wanting to work with kids, and I was very disappointed when I found out that we weren't gonna be able to. But
Mhm.
it ended up being amazing because I found a population that I just adore, and I still adore, and I want at some point to be able to work with this population again in some capacity, which is the college age. But um, I got hired on at our practice, and they asked me if I'd work with kids. And part of the reason is because everything I've ever done has been with kids in my work history.
Mhm.
Um,
Yeah.
and I said yes. I was terrified. I was terrified because I had never done it. I didn't know what it looked like. I was scared to work with the parents and, like, what does it look like to work with a kid? Is it going to be chaotic? And it is chaotic, like
Mhm.
structured chaos, which, I've always said that organized chaos is my jam. It's where I thrive. But it was scary. And I agree with you that, like, I would really love to see those perimeters opened up a little bit because in our area, I am one of the very few that work solely with children and accept Medicaid. And it's like,
Mm.
there's not very many of us out there, and we do need more. There needs to be a lot more.
Mhm.
And so I would love for that to be opened up enough that there can be more experience on that side
Yeah.
of it.
Yeah. It's interesting because you had mentioned earlier, you're kinda getting to nip some of these things in the bud, like, as their children
Yeah.
by working through some of these skills, and I with so many of the adults that I see, it's like, you do wonder how much of this could have been avoided had you seen someone earlier in your life, like, as you were going through these things or yeah, even just, like, you don't just get over things that happen in your life, so I think that even just thinking like, I wonder what would have happened if they had been in counseling when they were young. And some people, when they were young, didn't have a good experience in counseling. And that's what's taken them so long to come back. But it is just, I think that that's a need that we have, especially in our community of having more people that have a heart for working with
Mhm.
kids because it's definitely lacking for sure.
Yeah. So, what would you say in your experience would be the most vast difference between the two populations besides age?
I think yeah, besides age. Honestly, it's hard to even describe, but just the way that the sessions go.
Yeah.
Like, for my adult clients, I don't really plan too much for their
Mhm.
sessions, but when I was working with kids, I always felt like I really had to plan, and I'm not super creative, so that was always a lot of work for me to plan because I was like, "Okay, I'm just, not as and I didn't have all the fun gadgets that you have in your office. But so I would say just the flow of the session is so much different, and that's hard to explain unless you've worked with both, but it just looks vastly different.
Yeah. Yeah.
What about you?
I think a hard day working with kids is looks so much different than a hard day working with adults.
Mm,
Like, a really heavy, hard day with kids has it has a bigger and harder effect on me emotionally than a big, heavy, hard day with adults.
mm.
So,
Why do you think that is?
because 'cause they're kids, because 'cause they're little. And
Yeah.
I have said this probably on here before, and I've said it to every person who says, "How do you do what you do? I could never do that." And it's kids are just so resilient, and the things some of the stories I've heard would knock a grown person down and out for a
Mhm.
long time. And these kids come in and they still have so much joy, and that is just part of their personality and who they are, and they don't come in down and out. They come in excited and with joy, and I mean, of course,
Yeah.
there are bad days and there are times when it looks different, but they are just so resilient and so joyful, and that is what I love about working with kids is the things that would knock a grown person out.
Mm.
Keep it's
Yeah.
just it's a part of their story, but it does not define them yet.
Yes. Yeah, I love that. I
Mhm.
think that's a great explanation, and it is hard. Being a counselor is hard on days, for sure, but it's just something just keeps us going back. Seeing the work that your clients are doing and knowing that you're helping
Mhm.
just keeps you coming back every
Yeah,
day.
it's knowing that you are
It's the
the
best.
bright spot in someone's week. You might be the only
Yeah,
thing,
for sure.
but it's
For
definitely
sure.
something that, you know, we were put on this earth to do, and you know it. Like,
Mhm.
it's just something that you know.
It's a calling, for sure.
100%.
Okay, we have 2 segments that we have to do. First, we have Rosebud Thorn.
Oh, yeah. Well, it's been a week here. Why don't you go first?
Okay. Mm, my rose is I'm trying to think. I've had some good progress with clients, I feel like, so that's been encouraging. And my bud is my parents are coming this weekend, so I'm very excited about that. They're visiting. That's more personal life than counselor, but I think that your personal life does impact how you're able to counsel others. So that is super exciting. And then my thorn is my baby was sleeping through the night and now I fear he is not. And so I'm very tired and that's been kind of hard. So hopefully he gets back to sleeping better.
That's rough. I remember those
How about
days.
you? Yeah, it's always a guessing game.
Uh-huh. My rose would be in grad school, I never did virtual, and I have had to do it a couple times, and I have had a couple really good virtual sessions, which is very exciting because I feel like virtual is just harder, at least for me, but probably because I'm inexperienced. But I had 2 really good virtual sessions this week, which was great. But, hmm, I don't know that I have a but. Yeah, I do. I have a couple of clients that I had to cancel our first session after intake because my son broke his hand, and I get to see them this week, and I'm excited to see them. And so that would be that. And then my thorn is that I got in a car accident on Friday. I'm okay, but my car is out of commission, and so I couldn't make it to work today, and I had to cancel 3 sessions, and I hate, hate, hate doing that.
Mhm. Yeah. That's hard
Yeah,
to do.
yeah.
Okay, moving on to couch confessions. Let's see. One of these, I found a post. That's what I'm looking at on my phone. I found a post of a therapist who said things that she does that some of them are interesting. Some of them I can't say that I would do, but we're going to talk about one of them. This one says, walked to a food place and talked on the way and ate with them, and then walked back while doing our session that way. What do you think about that?
I have often thought about taking if we our office was somewhere else about taking a client to like to a park or to go play basketball or something.
Mhm.
I think it could be very beneficial and therapeutic. We are always
Yeah.
preaching, get out in the sun and exercise.
Mhm.
I think it could be very therapeutic. What do you think?
I agree. I was actually just talking to our boss about this the
Were
other
you?
day where I was like, I wish we could take a walk with our
Yes.
clients and like get outside because it was so nice out. And in the winter, like I feel like the sun cures everything.
Yeah.
And so I'm like, oh, I was feeling sad and now I'm happy again because the sun's out. But yeah, I was just saying, I'm like, I wish we're in a location where we could go on a walk, which I mean, I guess you could, but you'd be walking in parking lots.
Yeah.
Uh, yeah, definitely something that I would do. I don't know about like I don't know if I would want to like eat, lunch with a client, but I would definitely go outside of the
Yeah.
office, outside of the room if they wanted to or felt comfortable.
What
So,
did our owner say about that?
interesting things. What'd you
What did
say?
our owner say about that?
He agreed.
Yeah. Yeah.
He's like, I often wish the same.
Yes.
And so I think that's a common thing. I knew at my old office, some of the therapists would do that. They'd just go on a walk with their
Yeah.
client. And I think that's really cool.
Yeah.
So, yeah, that's all we have. That's, I guess, not a confession on our part, but it's interesting to hear other therapists' confessions.
Sometimes and it gives us some it's a good tool to be like, when you're out of grad school, this is something you can consider. Like, what if?
Mm-hmm.
What if you had the opportunity to take the client, especially one who is depressed, out
Yeah,
to get a walk and just some fresh air and a perspective.
yeah,
So,
for sure.
yeah.
All right. I think that's all we got for today.
Yay.
Thanks for listening, everyone. And we will see you next week.
Like, what is it? Like, comment, and subscribe.
Oh, yes. Like, comment, and subscribe. Thanks for
Thank
listening.
you.
Bye.
Thanks for hanging out with us on Couch Conversations Beyond the Textbook. If today's episode resonated with you, be sure to subscribe, leave a review, and share it with someone you think can relate. Keep showing up, keep learning, and remember, the best growth doesn't always come from a textbook. See you next time.